now declared states of emergency.
COVID-19 will impact First Nations very differently from the rest of Canadian society.
Leaders are concerned about the on-reserve population, where more people live with respiratory issues, kidney disease, and diabetes, and overcrowding in small homes is a reality for thousands of families.
When you live in a home that has 10 people, that is a challenge. So that sanitation is very critical at this time.
The chiefs are demanding action from the federal government, and help has been promised to access funding for supplies and extra nurses. And this week, the announcement of an additional $305 million to address immediate needs in First Nations, Inuit, and Métis communities.
We lack the proper health facilities. We don't have the health staff in our communities. Transportation is a huge issue.
During the last pandemic, the H1N1 swine flu, Indigenous communities were considered especially vulnerable, and leaders were outraged when health officials sent body bags north. Now there's the promise of more disinfectant, sanitizer, and testing kits. Some remote First Nations have also requested large isolation tents, portable structures to allow for COVID testing away from community hospitals and the sick and vulnerable. Omar?
CTV's Jill Makashon in self-isolation at her home in Winnipeg. Jill, thank you. Well, retailers are supposed to be discouraging crowds, but it seems